New data shows African Americans in the St. Louis area are 4 times as likely to test positive for COVID-19. Alexis Zotos explains what county and city leaders are doing to address the disparity in infections in the Black community.
10,000 masks were handed out this afternoon in North St. Louis. The hope that increased awareness can help stop the spread in the hard-hit communities. New data shows the Black communities of St. Louis are 4 times more likely to test positive for COVID-19 and 2.5 times as likely to be hospitalized.
They make up about 50% of all of the cases of tested positive COVID. And so what that tells us is that there's something that's contributing to a higher positivity rate amongst the Black community.
The death rate in St. Louis City shows African Americans make up 62% of those claimed by the virus.
We can't continue to just look at the data as data, but we really have to look at the data as people.
People like Jasmine Dixon. The 31-year-old was the first person to die in the city of St. Louis from COVID-19. But the contributing factors of why this community is hit harder are systemic and go back long before she was even born.
Things such as poor access to health care, chronic medical conditions, poor access to food, dense living populations, all of those things can contribute to a higher positivity rate.
They found a higher percentage of the Black community were also deemed essential workers, increasing their exposure. So what is being done? In the short term, free testing for everyone and more PPE. Long term will be the harder part.
Making sure that we integrate health and racial equity into every program, every activity that we do. And so that started before COVID-19 happened. And so we were in some ways ahead of the curve a little bit, but there's still a lot of work to be done.
Alexis Zotos, News 4.